Bismillahirrahmanirrahim. Today's topic is the tonsils. You can see this is the pharynx which extends from this bone, which is known as the body of the sphenoid bone, and then this is the C6 means cervical 6 vertebrae. Up to this level, this structure is known as the pharynx. The pharynx is divided into three parts. The part which is behind the nose is known as the nasopharynx, and the part which is behind the oral cavity is known as the oropharynx, and the part which is in behind the larynx is known as the laryngopharynx. Now we are going to discuss the tonsils. The two tonsils are present in this nasopharynx. In the roof, this one is known as the pharyngeal tonsil, while this is the auditory tube. Near the auditory opening of the auditory tube, this tonsil is known as the tubal tonsils. Tubal tonsils are two in number because the auditory tubes are two in number, while the pharyngeal tonsil is present only in the roof, so it is single in number. And this is the oral cavity. This oral cavity contains the palatine tonsil, which are also two in number. And this is the fossa in which this palatine tonsil is enclosed, and it is bounded from above by soft palate. This is the hard palate, and this is the soft palate. So, roof or superiorly, it is formed by the soft palate, and inferiorly, this is the tongue. This is the anterior part of tongue, and this is the root or the posterior part of the tongue. So, floor is or inferiorly, it is formed by the root or the posterior one third of the tongue. And this is a muscle enclosed in the mucosa known as the and forming a fold known as the palatoglossal fold. This is palate, this is tongue. So palate and glossal word is used for the tongue. This is the palatoglossal fold which forms its anterior boundary, and posteriorly this fold is known as the palatopharyngeal tonsil. So these are the boundaries of the tonsillar fossa. Now you can see this. These are the tonsils present in the form of a ring, and this ring is known as the Walters ring. There is important point that this nasopharyngeal tonsil it enlarge in children up to the age of 6 years. This one, and this condition is known as the adenoid. Then gradually atrophy till the puberty and almost completely disappear by the age of 20. Not the gland is disappeared. Its prominency which is present in children is which is known as the adenoid. So in adenoid is present only at the age of the 6 year. Now the nasopharyngeal, this tonsil when enlarged due to the infection is known as the adenoids, which block the posterior because it is present in the posterior part of the nose and in the roof of the nasopharynx. So it causes the difficulty in breathing by nose, so the mouth breathing obligatory appear. So what are the symptoms of these adenoids? The children will show the nasal obstruction, nasal discharge, mouth breathing with protrusion of the tongue, toneless voice due to the absence of nasal tone, small nose, and epistaxis mean bleeding from the nose. Now this Welder's ring consists of single pair of the pharyngeal tonsil and single pair of single tonsil known as which is present in the roof of the nasopharynx is known as the pharyngeal tonsil, and this lingual tonsil is buried in the inside the muscles of the tongue, While the tonsils which are present in the pair form, they are the tubal tonsils, and this is the palatine tonsils are also two in number. And this ring is known as the Valdes ring, and it is present anterior to the pharynx. So this is in large picture which shows the Valdes ring. Though the Valdes ring consists of single pharyngeal tonsil and the lingual tonsil, the paired tubal and the palatine tonsils. This is another diagram. So the tubal tonsils and the pharyngeal tonsils are present in the nasopharynx, while the palatine tonsils is present in the oropharynx. And lingual tonsils are buried in the posterior one third of the tongue, not in whole tongue. Now the features of oropharynx. This one I have already told that this is the fossa which is containing of palatine tonsils, and what are the boundaries of the palatine tonsil, palatine fossa. Superiorly soft palate, inferiorly posterior one third of tongue or root of the tongue, anteriorly palatoglossal fold, posteriorly the palatopharyngeal fold. So the boundaries of the pharyngeal or palatine tone fossa is very important for exam point of view. Now anteriorly, this one, this is the tongue. The anterior, this portion is known as the anterior two third of tongue, and this is the posterior one third of tongue. Lingual tonsils are buried in the posterior one third of tongue. So they are present anteriorly in the, because the palatine tonsils are present in the on both sides, and lingual tonsils and at the roof there will be the presence of pharyngeal tonsil. So the lingual tonsils formed by the numerous nodules of the lymphoid tissue underneath the mucous lining of the pharyngeal part or posterior one third of tongue. So now the boundaries of the tonsil. What are the boundaries of tonsillar fossa? Anteriorly the palatoglossal fold, which is consisting of the palatoglossal muscle, and posteriorly the palatopharyngeal arch or fold, which is consisting of the palatopharyngeal muscle, and in the apex, this one in this diagram you can see, and this is the apex consisting of soft palate or roof, while in the floor or base is formed by the posterior one third of tongue. These are the boundaries of the tonsillar fossa, very important. Now this diagram shows the lateral wall or the tonsillar bed. This muscle, it consists of the superior constrictor muscle. Which muscle? Superior constrictor muscle. This is the superior pharyngeal constrictor muscle. Now the structures forming the tonsillar bed are also an important question for exam point of view. From sequence from outward to inward, you can see this one is the, this muscle is the superior constrictor. So not the middle and not the inferior constrictor are present in the tonsillar bed. Only the superior constrictor muscle, styloglossus and palatoglossals are also present, and palatopharyngeus is also present, but the most commonly is the superior constrictor muscle. Before this superior constrictor muscle is the fascia, buccopharyngeal fascia, then superior constrictor muscle, and then the pharyngobasilar fascia. And this is the space which consists of the loose tissue is known as the peritonsillar space, and it contains the paratonsillar vein. These structures are present in the tonsillar bed. In this diagram, you can see this one end of the tonsil is attached, which is attached with the oral cavity, and it is consisting by the connective tissue. And the anterior free end is consisting of the tonsillar crypts, which are very deep tonsil crypts. And this surface is lined by the stratified squamous non-keratinized epithelium. not the keratinized, lined by stratified squamous, non-keratinized epithelium. And the crypts are mainly in numbers 12 to 15 in numbers. Now this is another diagram showing the parts forming the tonsillar bed. This is the fascia, this muscle, and then again the pharyngobasilar fascia.